There are several ways cancer might kill someone. The most lethal cancers are metastatic, where a single cell breaks off, migrates, and starts a new tumor. The tumor can fill up any organ and prevent it from functioning. Generally speaking, if cancer takes over an organ that performs an essential function, it can kill you. For example, if the cancer is growing in a part of the digestive system, it can prevent the digestion and absorption of food. It can also block the expulsion of feces and lead to perforation, which is fatal if not surgically corrected. Another example is obstruction of the pancreatic ducts. This causes the pancreas to digest itself. Pancreatic cancer is among the most painful and deadliest types of cancer. If cancer affects the lungs, there can be too little effective lung tissue to allow oxygen to be absorbed into the body. If this is the case, patients may die from asphyxiation. This is the most common cause of death in lung cancer. The second most common cause is infection. Having cancer impairs immunity, and chemotherapy compounds the problem by suppressing the bone marrow, the factory where white blood cells are produced. This explains why any kind of infection is especially concerning for people with cancer. The bone marrow's function may be impaired not only by chemotherapy, but also by the infiltration of cancer cells. When cancer grows in the bone marrow, there will eventually be inadequate healthy bone marrow to make blood cells. This has several implications. First, it will cause anemia, and insufficient oxygen will be carried around the body. Second, it will cause a drop in white blood cells. As these fight infection, it becomes more and more difficult to keep bacteria under control. And third, a drop in platelets will prevent the body from controlling any abnormal bleeding. Because the major organs are so vital for life, these are all parts of the body that are hard to operate on. Assuming the operation is successful and you remove the tumor without lasting damage to the organ, the tumor may grow back. All it takes is a few cells of the original tumor remaining in the body. This is why surgery combined with chemotherapy is important for treating these cancers. Besides organ failure, a cancer patient may suffer from wasting, called cachexia. This is due to toxins released by cancer cells that inhibit appetite and affect the digestion of food, leading to rapid weight and muscle loss. Cachexia is estimated to occur in 50% of all cancer patients, and it's thought to directly cause up to 30% of cancer deaths because of heart or respiratory failure related to muscle loss. It even accounts for 50% of deaths in patients with gastrointestinal tract cancers, and up to 80% of deaths in patients with advanced pancreatic cancer. Many treatments can control cancer for a long time, but if cancer continues to grow, it can become too much for the body to cope with, and ultimately, the treatment can no longer keep it at bay. At this point, it may be time to focus on comfort and quality of life. Know that good pain control is available, and no one with cancer should die in pain. You may have heard that giving strong medications such as morphine may hasten death. However, experts say that opioids are vital to relieving suffering and can prolong patients' life. Noticing one of the following symptoms doesn't mean you have cancer. These symptoms are more often caused by something less serious. However, if it is cancer, spotting it early can make a significant difference. 1. Weight loss. Unexplained weight loss of 10 pounds or more may be one of the first signs of cancer. In fact, 40% of people say they experienced unexplained weight loss when they were first diagnosed with cancer. Weight loss is especially common in people who have esophageal, lung, stomach, or pancreatic cancer. Cancer cells demand more energy than healthy cells, so your body may burn more calories at rest than it normally would. Additionally, cancer cells release substances that affect your metabolism and interfere with the hormones controlling your appetite, causing further weight loss. 2. Very heavy night sweats or fever. Unlike sweats caused by hormonal changes in menopausal women, which occur sporadically, those linked to cancer tend to be persistent. Night sweats that drench you and require you to change clothes are concerning. Leukemia and lymphoma are among the cancers associated with night sweats. These cancers put you at greater risk of developing infections because your body isn't producing enough immune cells. During an infection, the body automatically increases its temperature to help fight against infections, causing both fever and night sweats. Just as your body temperature naturally rises when fighting an infection, your temperature will also rise in an attempt to kill the leukemia cells. This is part of the inflammatory response. 31% of 2,000 leukemia patients reported night sweats as a major symptom before their diagnosis when asked during a survey. 3. Unexplained bleeding. At first, a cancer may bleed slightly because its blood vessels are fragile. Later, as the cancer enlarges and invades surrounding tissues, it may grow into a nearby blood vessel, causing bleeding. The bleeding may be slight and undetectable, or detectable only with testing, such as with early-stage colon cancer. However, it could also be massive or even life-threatening. The site of the cancer determines the location of the bleeding. Cancer along the digestive tract can lead to blood appearing in the stool. Similarly, cancer in the urinary tract can cause bleeding in the urine. Bleeding into the lungs can cause someone to cough up blood. 4. Lumps. The good news is that a majority of these lumps are harmless and not a cause for concern. A benign lump can feel like a round, smooth rubber ball, while cancerous lumps are irregular, hard, and, contrary to popular belief, painless. They might seem to appear overnight and grow with time. 5. Fatigue. This isn't fatigue similar to how you feel after a long day of work or play. Extreme fatigue that doesn't get better with rest can be an early sign of cancer. Cancer uses your body's nutrients to grow and advance, so those nutrients are no longer replenishing your body. This nutrient theft can make you feel extremely tired. Lung cancer is the second most common cancer worldwide. More people die of lung cancer than colorectal, liver, and breast cancers combined. About half of all lung cancers are diagnosed after it has already metastasized. At this point, chances of survival are extremely low. The 5-year survival rate is only 4%. In contrast, about 1 in 5 lung cancers is diagnosed while in the early stage, where the cancer is relatively small and contained within the lung. The 5-year survival rate here is 63%, highlighting the importance of early diagnosis. Experts estimate that early screening could allow up to 75% of lung cancers to be detected at an earlier, more treatable stage of the disease. The most common symptoms are tied to the basic functions of the lungs and may include 1. Coughing that doesn't go away or gets worse. A lung cancer cough isn't easy to identify by type. What sets it apart from other coughs is how long it lasts. Most coughs caused by other conditions will clear up in a few weeks, but lung cancer coughs are chronic, meaning they last longer than 8 weeks. Many people with lung cancer say their cough just won't go away. 2. Coughing up blood. Hemoptysis can be a warning sign of lung cancer. In fact, it is the only sign present in 30% of people at the time of diagnosis. The blood is often present in small amounts, such as what you would find on a blood-tinged tissue. But any amount of blood sputum should be evaluated carefully by your doctor. 3. Respiratory infections. Many people diagnosed with lung cancer say that their symptoms were first dismissed by themselves, or even their healthcare providers, as being due to a respiratory infection alone. But when lung tumors grow near the airways, they can cause an obstruction that raises the risk of these infections. Repeated infections, such as pneumonia and bronchitis, are, in fact, common before lung cancer is diagnosed. 4. Spontaneous smoking cessation. It's been found that a significant number of people with lung cancer reduce the number of cigarettes they smoke or spontaneously quit smoking prior to their diagnosis. What's interesting is that very few symptoms of withdrawal occur in most cases. Until recently, this cessation was thought to be related to an attempt to ease coughing or a subconscious fear of developing lung cancer. However, studies now suggest that the ability to stop spontaneously may actually be an early sign of lung cancer. It could be that lung cancers produce chemicals that decrease the addictiveness of nicotine. And 5. Chest pain. Many people mention that they feel chest pain before they are diagnosed with lung cancer. The lungs themselves do not have nerves that sense pain, but pain can be caused by several things, such as the pressure of a tumor on nerves, pain in the ribs from cancer that has spread to the bones, muscle strain, or even rib fractures from repeated coughing. Although not everyone with lung cancer develops these symptoms, these are the symptoms most likely to appear before the disease spreads and becomes more serious. So, if you have a bad cough, recurring chest pain, or respiratory infections, see your family doctor. At the end of the day, you can't go wrong with listening to your body and being cautious. Please watch my next video if you want to know how people die from cancer, or how to recognize the symptoms of a dying person. A breast lump is the most common presenting symptom of breast cancer. But for about 1 in 6 women with breast cancer, the broad spectrum of symptoms doesn't include a lump. In this video, I'll tell you about the early signs of breast cancer and what to do next. Breast cancer occurs when breast cells mutate and grow out of control. If breast cancer spreads, it typically goes to nearby lymph nodes under the arm first, or around the collarbone. If it spreads beyond these small glands to other parts of your body, it's called metastatic breast cancer. Metastatic cancer is incurable, so early diagnosis is very important. Most breast changes are due to hormonal changes and are nothing to worry about. However, if you experience any of the following 5 breast cancer symptoms, see your doctor, even if they seem mild. 1. A lump in the breast or armpit. 2. Discharge from the nipple. 3. Dimpling on the breast. 4. Nipple changes, including the nipple turning inward, pulling to one side, or changing direction. Or 5. Irritation of the skin. Your risk for breast cancer increases with age. About 77% of women are over the age of 50 when they are diagnosed with breast cancer. Less than 1% are diagnosed in their 20s. If you have a close relative, a mother, sister, or daughter, who has had breast cancer, your own risk of developing the disease doubles. If 2 of these relatives have the disease, your risk increases 5 times. In many cases where breast cancer seems to run in families, a mutation in specific genes called BRCA1 and BRCA2 may contribute to the cancer. If you started menstruating before age 12 or went through menopause after age 50, your risk for breast cancer is also slightly increased. That's because your breast tissue is exposed to estrogen for longer periods of time. And finally, there is a clear link between alcohol and breast cancer. Those who have 2 to 5 alcoholic drinks daily have 1.5 times the risk for developing breast cancer as women who do not drink. If you think you might have breast cancer, what should you do? The most important screening test to detect breast cancer early is the mammogram. A mammogram is an X-ray of the breast. It can detect breast cancer long before a tumor might be felt. It is recommended that women aged 40 and older receive annual mammograms. Studies show that women who participate in mammography screening reduce their risk of dying from breast cancer by 41% and experience a 25% reduction in the rate of metastatic breast cancers. Schedule an appointment with your doctor today to discuss your screening options.